The spread of misinformation on the internet is a real concern and has proven to be especially so in the wake of the coronavirus outbreak. The illness has infected over 100,000 people globally, and more than 3,400 have died. And while there's certainly a need for urgency, experts caution there's really no reason to panic. Dr. Celine Gounder joins me now to explain. She's an internist, infectious disease specialist, and epidemiologist at NYU, New York University, Bellevue Hospital. She's also co-host of a new weekly podcast about the coronavirus epidemic. It premiered last Friday. So, Dr. Gounder, I want to sort of correct fact or fiction based on the coronavirus. Fact or fiction when it comes to the symptoms. You may have the coronavirus and not even know it.
That is true. What we're realizing is some people may be what we call asymptomatic, so they have no symptoms at all, or they might be minimally symptomatic. So you could have something that just seems like your regular cough, cold, and may in fact have coronavirus.
The children are immune to corona. Fact or fiction?
So they're not immune per se. There does seem to be something special about kids, though. We're not seeing severe cases and deaths of coronavirus from coronavirus among kids. So we will be studying their immune systems to better understand how they're able to fend off the infection so effectively, because there clearly is something different about kids.
Coronavirus can stay on the surface for more than a week.
That is true. And that's based on data we have on other coronaviruses, probably out to about 10 days. But a lot of that's really dependent on temperature, humidity, those kinds of factors. But out to about 10 days.
Is there anything you can do to, disinfect a surface that you think somebody may have coughed on or spread?
Yeah, and routine, regular cleaning supplies seem to do the trick, so it's nothing necessarily special. You might remember with Ebola, we were using a lot of bleach.
Yes.
I don't think it's even necessary to do that. Probably your regular 409 or Lysol will do just fine. Yeah.
Okay. Cats and dogs can spread the virus.
So this one actually really worried me at first when I had seen the initial reports. I have 2 dogs at home. And you may remember, for example, Nina Pham, the nurse in Dallas, who she had gotten Ebola and she had a dog at home, and there was all this controversy. What do we do with the dog, right? From what we've seen with the particular dog that tested positive in Hong Kong, it wasn't actually infected, it was contaminated, just like your table might be contaminated, or, and so that's an important distinction. So just like, if you touch the table and you have coronavirus, if you touch your dog and you have coronavirus, you could be spreading it there without infecting the dog.
How can we protect ourselves at this point?
Well, I think there are a few things that we should be doing. One is absolutely, and I know this sounds like really basic, but the washing hands thing really matters. If you had to choose between washing a hand and wearing a mask, the washing hands far and away will better protect you.
Why is that? Why is it so good for you? We hear it over and over again for everything, not just coronavirus. Washing your hands really works.
It does, because that's where you have all of these bacteria and viruses that you're picking up when you're touching, different things, whether it's a subway pole or shaking somebody's hand or in the bathroom, and then you rub your eye and you inoculate yourself with the virus. You rub your mouth, your nose, and you do the same thing. So that really is one of the best things you can do. I think some of the other things I would do is, if you are somebody who's on chronic medications for some sort of condition, reach out to your doctor and make sure you have refills on all of those. And if it's possible to get a 90-day refill instead of a 30-day refill, I would try to do that.
And what are the symptoms of coronavirus? How do you protect yourself?
So coronavirus, we now realize, infects both the upper and lower respiratory tracts. So upper respiratory tract meaning either your nose, your throat. So that's sort of the common cold symptoms that you get with that. Whereas if it infects the lower respiratory tract, so into the lungs, that's pneumonia. So, it could be anything from fever, cough, runny nose, sore throat, to shortness of breath, difficulty breathing, that sort of thing. So it's really a wide range of things, not to mention fever would be another symptom.
How do you get tested?
That is a very good question. One thing that's very challenging in this country is we don't have a centralized top-down approach to public health. Yes, we have the CDC, they get called in to advise and consult, but it's really local and state public health departments that run the show, and everybody does things a little differently. So what you need to do is reach out to physicians in the area who would know this, or you yourself reach out to your local or state health department to find out how they're approaching that.
Now, I'm just curious, if you catch it early, is it curable?
I think curable is probably not the right word, because that would imply we're giving you something to make you better. If you catch it, and let's say you're somebody who has, I don't know, emphysema, and we catch it early and we hospitalize you and give you supportive therapy. So not necessarily curing you, but sort of helping you through. Maybe it might be oxygen, supplemental oxygen, or something like that. You know, that certainly could make a difference.
All right, I want to thank you very much for joining us with Fact or Fiction on coronavirus. Thank you, Dr. Celine Gounder.
My pleasure.